everybody, it's Chris from the West Hartford Chamber with our latest episode of Health Fix in 26. Today we're at Central Eye Care, and I'm actually going to get a long time coming eye exam with Dr. Rasks.
Good morning. Welcome to Central Eye Care. My name is Dr. Jennifer Rasks. I've been practicing in town for over a decade, but I opened my own private practice about a year ago. I am passionate about pediatric eye care and have invested in technology to facilitate a pediatric exam. I also love to fit specialty contact lenses as I feel it's the most impactful change I can make in a patient's quality of life. If you're looking for a new eye care provider, feel free to come visit us. We hope to see you soon.
And open real big. And divert blue light. Perfect, all done.
DVKR.
Tickle your eyelashes, but I promise it won't hurt. You can look. There's two ways that we can take a look at the inner structure of the eye, specifically the retina. It's the home of the optic nerve and the macula. And one more.
RTCNB.
And is it clear to you here with option number 1? The image of your eye.
That's
pretty cool, huh?
very cool.
So this here is the cornea, the front structure of your eye. This here is the iris, the colored part of your eye. Traditionally, we use dilation drops to open up this window really wide to take a peek inside. This OptoMap technology gives us a full view of the retina. It's kind of like seeing the forest instead of just a tree at a time. So let me zoom in here. We can take a look at each eye. This is the right and the left eye. These yellow structures, these are your optic nerves. They're the direct connection between each of your eyes and your brain. We map out their size and we monitor for small changes from year to year to rule out your risk of glaucoma. Then we take a look at the macula. That's the central part of your vision here. Anytime you look directly at something, you're using that sensitive tissue. When we zoom in, you can see, can you appreciate this gradient here?
Yep, I can.
So each grain is an individual photoreceptor, which is a specialized nerve ending. And their job, they work kind of like tiny cameras. They take a picture of the world and send that information back to your brain for interpretation through this optic nerve. For patients with a family history of macular degeneration or on long-term risk medications for complications with retinal health, this autofluorescence, this black and white image, is actually the most information we can gather about the retinal health. It gives us a sense of how healthy the cells are, how well they're functioning. And if there was any loss of function, we would see white lights here, which would precede structural damage. So this is even more information than I can gather just by taking a look at a dilated exam alone. And then we take a look at the blood vessels. Let's go back to that red and green image here. So the blood vessels in the retina are some of the most delicate in the body. They're typically the first to be affected by poorly controlled systemic vascular disease, such as high blood pressure, high cholesterol, diabetes, or anemia. We can zoom in here and take a look at the health of these blood vessels, and you can see yours are perfectly healthy. There's no abnormal leaking or fluid building. And then just like we have a pigmentary layer in our skin, we do have one in the retina as well, and it's susceptible to sunspots over time. As we take a look at your image, this filter here looks directly at that pigmentary layer, which is the bottom of 9 layers, and yours looks great. There's no evidence of abnormal sunspots or pigmentation. As a dermatologist would tell you sunscreen, I tell everybody sunglasses. The majority of sun cancers that we're finding on our face, about 30% of them are on our eyelids because we can't put sunscreen there and we're not utilizing sunglasses enough.
Well, that was fantastic. Thank you to Dr. Rasks for that very comprehensive eye exam. Good news is I don't need glasses other than my readers, but I got to see inside my eye, which I've never done, and learned a lot about the practice and how good eye health benefits overall health.